We all experience sadness. It is a natural human emotion, a response to loss, disappointment, or hardship. Depression, however, is different. It is not just feeling down. Depression is a serious mental health condition that goes far beyond temporary sadness. It casts a long shadow over every aspect of life: thoughts, feelings, physical health, and behavior. Imagine a weight constantly pressing down on you, making it difficult to find joy or motivation. That is what living with depression can feel like. It is crucial to understand that depression is not a sign of weakness. It is a medical condition, just like diabetes or heart disease, that requires understanding and treatment. It is important to remember that if you are experiencing depression, you are not alone. Millions of people worldwide struggle with this condition. There is hope, and help is available. Recognizing the difference between sadness and depression is the first step towards seeking the support you deserve. Depression manifests in a myriad of ways, and its symptoms can vary from person to person. Some may experience a few, while others grapple with many. It is essential to remember that there is no single look for depression. It is a deeply personal experience. One of the hallmarks of depression is a persistent low mood. This feeling of sadness, emptiness, or hopelessness lingers for most of the day, nearly every day for at least 2 weeks. Loss of interest or pleasure in activities once enjoyed is another key indicator. Things that used to bring joy, like hobbies or spending time with loved ones, may now seem unappealing or even burdensome. Changes in appetite or sleep patterns are common, with some experiencing significant weight loss or gain, insomnia, or excessive sleep. Fatigue and low energy levels can make even simple tasks feel overwhelming. Depression can also manifest physically, with headaches, digestive issues, and muscle aches. For many years, depression was shrouded in stigma and misunderstanding. However, advances in neuroscience have shed light on the biological underpinnings of this complex condition. We now know that depression is not simply a matter of willpower or snapping out of it. It is rooted in the intricate workings of the brain. Research has shown that imbalances in certain chemicals in the brain, known as neurotransmitters, play a significant role in depression. These chemicals, including serotonin, dopamine, and norepinephrine, act as messengers between nerve cells, influencing mood, sleep, appetite, and other vital functions. When these neurotransmitter levels are disrupted, it can lead to the debilitating symptoms of depression. Furthermore, studies have revealed structural and functional changes in the brains of individuals with depression. For instance, the hippocampus, a brain region involved in memory and emotional regulation, tends to be smaller in people with depression. Additionally, the prefrontal cortex, responsible for decision-making and emotional control, may show altered activity. Section 4. Causes of depression, a complex interplay. While the biological basis of depression is becoming increasingly clear, the causes of this condition are multifaceted and not fully understood. It is generally believed that depression arises from a complex interplay of genetic predisposition, environmental factors, and life experiences. Genetics undoubtedly play a role. Research suggests that individuals with a family history of depression may be more susceptible to developing the condition. However, having a genetic predisposition does not guarantee that someone will develop depression. Environmental factors such as childhood trauma, abuse, neglect, or chronic stress can significantly increase the risk. Life events, both positive and negative, can also trigger depression. Loss of a loved one, job loss, financial difficulties, relationship problems, or major life transitions can all contribute to the onset of this condition. It is important to note that there is no single cause of depression. It is often a combination of factors that converge to create the perfect storm. Section 5. Seeking light, treatment, and hope. The good news is that depression is treatable, and with the right support, individuals can recover and live full, meaningful lives. The first step towards recovery is seeking professional help. A healthcare provider can assess your symptoms, provide a diagnosis, and recommend the most appropriate treatment plan. Therapy, particularly cognitive behavioral therapy or CBT, and interpersonal therapy or IPT, has proven highly effective in treating depression. CBT helps individuals identify and change negative thought patterns and behaviors that contribute to depression. IPT focuses on improving interpersonal relationships and communication skills. Medications such as antidepressants can also play a vital role in treatment. Antidepressants work by balancing neurotransmitter levels in the brain. It is important to note that antidepressants may take several weeks to reach their full effect and should only be taken under the supervision of a medical professional. In some cases, alternative treatments like electroconvulsive therapy or ECT or transcranial magnetic stimulation or TMS may be considered for individuals who do not respond to traditional treatments. ECT involves passing a small electrical current through the brain, while TMS uses magnetic pulses to stimulate nerve cells. Remember, seeking help is a sign of strength, not weakness. Reach out to a trusted friend, family member, or healthcare professional. You are not alone, and recovery is within reach.